Okay, hopefully this is working. We'll see. Yay! Okay. Gonna go ahead and go live on Facebook. All right, we're going there. We're going here. I'm gonna close that out, drop that down. Hello, everyone. Hello, how are you guys doing? Hopefully everything's working. Let me get, I've got my PowerPoint set up. Hey everyone, hey everyone. So what are we talking about today? And I've got my own mug up underneath here, so let me fix that. What's going on, guys? What's up? Happy Saturday. Hello, hello. So today we are actually going to talk about depression. Here, let me fix my picture. Hopefully that will stick right there. I hope everybody can hear me. Can you hear me okay? Let me check my levels. That seems to be fine. All right. Let me see. Make certain we are all on. I'm connecting to Twitch. Let me see. I don't see Discord on here, so let me try reconnecting on Discord. Hopefully Discord will reconnect. I'm hoping this will work. You never know. Sometimes it's funky and it doesn't want to work right. All right. Hopefully that's up. Sound is good. Yay. Discord. All right. Discord is on there. Yay. So we've got all frequencies are open, Captain. All frequencies are open. So today, this was the voted on topic, and it's quite apt given all of the recent news and everything associated with the increased rate of suicide, especially in the U.S., as well as the increased amount of people who are being diagnosed with depression. So this was almost a tie with cancer and with how humans evolved. So it was really close to being a three-way tie. This beat out all of the other topics by 1%. It beat out cancer by 1% in regard to topics. So let's go ahead and get started. So today we are going to talk about depression, aka the black dog. So I thought this would be a really, this is actually quite an apt talk that we're going to have, as I mentioned before, because of the increased rate of suicide we're seeing, especially in the U.S. So what exactly is it that I'm going to talk about? Well, we have a lot of questions to cover. But it's not too arduous, and it's not going to be incredibly difficult. The things that we're going to focus on in this particular talk today is what it is, what in the heck is depression? Are there types? Yes, there are types. There are different types, and there's different things that are associated with those types. The symptoms, the risk factors. We're going to talk about where we see depression primarily, what the treatments are. We're also going to talk about suicide. Since suicide is inherently linked to depression, it's actually pretty startling, the numbers associated with that. And we're also going to talk about what we can do in regard to being those who are non-sufferers in depression. So a lot of the sources that I'm going to discuss and cover are very reputable sources. This particular one I'm going to reference in this case is the National Institute of Mental Health from NIH. And so they basically discuss that depression is a major depressive disorder or clinical depression. It's very common, but it's serious. It's considered a very serious mood disorder. It causes severe symptoms that affect not only how you feel, but how you think, how you can handle your daily activities in your life. It disrupts sleeping, eating, and even working. Now, in order to be diagnosed with clinical depression, the symptoms must be present for at least 2 weeks. So the important things that I kind of want to hit home in regard to this talk is that it is common. It's very common. It's severe in the symptoms. It affects everything every single day. So it's important, in a message that I kind of want to impress upon individuals. Not all illnesses are visible, and depression is very much an illness. It's not something like we see like with leprosy, where you have sores on your body. It's something that is internal, something that you can't see. It's not like cancer, where you know somebody's having chemotherapy and their hair is falling out, or they have the visible symptoms of that. It's not like that. It's not a visible illness from what we can see. So it's vastly misunderstood. So this is a good topic for us to kind of talk about today. Now, much like everything, depression is a spectrum. There are varying types, and each have different levels of symptoms as well as triggers. Now, I'm going to go through each of these particular types of depression, and I'm going to kind of help you understand what they mean, so we can all understand what they mean and how they affect those who are diagnosed. So there's different types of depression. There's persistent depressive disorder, postpartum depression. It's not just baby blues. We're talking something a bit more profound than that. Psychotic depression, seasonal affective disorder, and also bipolar disorder. Now, bipolar disorder in itself isn't depression, but because of the effects it can have on an individual, it can still be related to depression. Okay, yeah, and some of you might have the bipolar disorder, and so you're going to be prone to lots of mood swings, and this can kind of clinically go along hand in hand with depression. So because of the things associated with bipolar disorder, it's considered part of depression. So, there we are. And if you notice, there's a chat going on the side here. This is Periscope, this is YouTube, this is Twitch, and this is also Discord. So if you're on Facebook, I'm unable to link your chat here on the side, but if you have questions and you're on Facebook, drop them off in the comments. If you're currently watching, I can go back and I can see your questions and answer them accordingly. So let's talk a little bit about these different types of depression. So depression, the first one I'm going to talk about is the persistent depressive disorder. This one is also called dysthymia. Dysthymia. It's hard to say. Now, this particular version of depression, or this particular diagnosis or disorder, lasts for at least 2 years. Now, a person with this particular depressive disorder can have episodes of major depression along with less severe symptoms. So they'll have like massive bouts and struggles with major depression, and then sometimes it'll be less severe. Well, you're welcome, Mrs. Snarky. I'm glad that this was a good voted on topic, because I think there's a lot of misconceptions about depression and what it is. So it's good that we're having open dialogue. Now, before it can be considered persistent depressive disorder, the symptoms must last for 2 years to be considered this particular type of diagnosis. Now, the postpartum depression, it's not baby blues where you have a drop in your hormones and you feel a little sad. You know, it's a relatively mild depressive and anxiety type of symptoms that are usually within 2 weeks after a baby is born, so after delivery. Now, many women can experience it after giving birth. Now, with postpartum depression, the experience is full-on, full-blown major depression during pregnancy or after delivery. Hello, you're also a Melody. Well, hello, Melody Mayhem. I like your name. So we're talking about full-blown depression. We're not talking about feeling a little sad right after birth. We're talking about actual major depression that can happen throughout pregnancy and even afterwards. And so these types of feelings are extreme sadness, anxiety. They're exhausted all the time. Now, this accompanies postpartum depression, and it makes it difficult for these new mothers to complete daily care activities. Postpartum depression can also last a very long time. Now, psychotic depression. Now, this usually goes along with somebody who already has some form of psychosis. And so they have depression, but they also have a psychosis kind of linked to that. So they could have disturbing false fixed beliefs like delusions. So they can be delusional. Excuse me. They can see or hear upsetting things. Okay, you're trying to figure out which one you have with mental health services at the moment. But it's good that you're going to the doctor to kind of work through these things, because it is a spectrum and it's hard to kind of throw in and see where it is. It takes a lot of testing, and I'll talk a bit about what you can do. Excuse me. So the people with psychotic depression have some other kind of psychosis along with their depression. So they could have delusions, they could be seeing or hearing very upsetting things, so like hallucinations. These particular psychotic symptoms have a depressive theme. So these delusions are kind of linked to their depression. So they could have guilt, they could have illness, they could have poverty, they could have all these other things that are kind of like linked to certain triggers for people who are susceptible to depression. So what the next little phase I kind of want to talk about, I'm still going through all of the different types. Okay, so for seasonal affective disorder. Now, I know some people that actually suffer this type of depression. Now, that's characterized by depression that's linked to winter months. So when there's less natural sunlight, some people experience that type of depression. And that depression usually kind of lifts a bit during the more spring and summery type of months. Now, sunlight is very, very important, especially for our circadian rhythms. If you're unfamiliar with circadian rhythms, the body naturally has light as a trigger to kind of start certain biochemical reactions to get you through your day. So some people who have insomnia at night, sometimes it works for them to wake up. First thing that they do is wake up, go outside for about 5 to 10 minutes and get some sunshine, to try to help those particular circadian rhythms, those biochemical type of reactions to kind of kick in to get you to start your day, so you'll have your natural cues at night to help you sleep. Well, guess what? The same thing can happen with certain individuals who suffer depression. They could have seasonal depression, so one way that they can treat that is to have sun lamps. So in the winter months, they have a sun lamp right next to their bed. They sit up, they blast themselves with a little bit of natural sunlight generated through these particular lamps, and that can help treat a little, well, at least help treat the symptoms associated with seasonal affective disorder. So these particular symptoms, people with this winter depression accompanied by social withdrawal, increased sleep, sometimes they have weight gain, and this can be predictable every year in seasonal affective disorder. A sun lamp might be useful for you, Mrs. Snarky. It might be. You suffer mild agoraphobia. Well, fair enough. So, bipolar disorder. Now, this is different from depression, but it's considered included in the list because somebody with this particular disorder, as I mentioned before, experiences similar, if not exactly the same, types of depression as people who are clinically diagnosed with it. Now, they can have euphoric moods or irritable moods, so they can have mania, or they can have less severe form of mania called hypomania. Now, recently, there are other examples of depressive disorders that have been added to what we call the DSM-5. That's the Diagnostic Classification of different type of psychological disorders. Now, the new ones that they're still kind of looking around and focusing on are disruptive mood dysregulation disorder. That's primarily diagnosed in children and adolescents, and as well as premenstrual dysphoric disorder. And so these have been recently added to, and they're kind of a new type of field, or at least new disorders that they're trying to get a bit more information about. Hypomania is so irritating. I imagine it is. I imagine it is. I am not a person who has suffered hypomania, so I cannot speak from personal experience. I myself do not have depression, so that's always something that's, you know, I try to take in, and when I've compiled this, and I've written an article before on my website, ScientistMel.com, and I'll actually read a little bit of that to you today about how to respond as a person who doesn't suffer depression. I tend to get a little anxious, so I tend to have a little bit of anxiety sometimes, but I've not to my knowledge, I've never been fully depressed. So I try to take what people who suffer bipolar and depression, and I take to heart what they say, and I try to communicate that as best as I can. You can't stop the thoughts, nor can you really distinguish between them. Sleep doesn't happen even if your body is tired. Yeah, runaway mind, I suppose, hypomania. So it's really hard to kind of control your thoughts. So let's look a little bit about kind of a sum up about the depression types. So persistent depressive disorder lasts at least 2 years. So it has to last at least 2 years for that to be a thing. Postpartum depression, it's major depression after birth, but also during pregnancy. Psychotic depression is depression that is linked to another type of psychosis. Could be delusions and hallucinations. Seasonal affective disorder, depression with lack of sun. And so one way to treat that is with sun lamps. And I know people who use that, and it seems to be fairly effective for them. Now, it's important to realize that every single person is different. All right? Every single person is different. At least you try to understand. Many people don't even try. Understanding and learning can be quite an arduous task, and it can be very tiring, and sometimes people just don't want to have to deal with it. But if they're going through a mood where they don't want to learn something, it's still important to go back and try to learn and try to understand when they're feeling more up to it, especially in the current administration where all the news is scary and awful. Sometimes it's important to kind of shut it off, say, okay, I need a break, and then you come back to it. So I understand both sides of that. A lot of people don't want to necessarily talk about depression and suicide right now. Maybe they're still grieving some of the stuff that's happened, but it's important to come back to it when you feel like you're able to try to understand. And then bipolar disorder. So even if they're not technically clinically depressed, they still fit that depression criteria. I'm glad you guys are enjoying this. You have a serotonin deficiency. It sucks. You know, when your brain chemistry is off, the thing that I try to reiterate to people, and that's something that they don't understand, is if your brain chemistry is off, if the thing that controls your body and your thinking and your speaking and your daily activities is not 100%, you know, that's going to affect you system-wide. That's going to affect you system-wide. It's not something you can just snap out of. The control center for your entire body is wired a bit differently, or maybe it's hyper-wired to where you're constantly worrying about a thing, or it's, you know, I can't move because I'm hurting, you know, and your brain is convincing you you're in pain and you can't move. I mean, it's not a visible illness. So it's tough. It's very tough. You know, you can't just walk it off. You guys are sweet. I'm glad you guys think I'm awesome. I'm trying. Some days, though, it's just like some days you're like, I just want to lie on the couch and watch TV. I don't suffer depression, but there are days where I want to put on my jammies and not move. Not move. Just binge watch something on my couch over there say, I've checked out for the day. But I'm glad I'm able to do this and have this talk with you guys today, because it's a serious talk. It's serious, and we need to understand that people are different. You can't just walk it off. So I'm gonna put you on my big monitor here, and we're gonna talk about the signs and symptoms. So let me transform this and fit it to my screen, because apparently it has hopped around. I can relate to that. All right, so let's talk a bit about these particular symptoms. These are signs and symptoms associated with depression. Now notice, these are a lot of signs and symptoms. We have persistent sad, anxious, or empty mood, decreased energy, fatigue, feelings of hopelessness or pessimism, moving or talking more slowly. People who have depression even have a hard time formulating words. So that's something you need to keep in mind. Moving or talking slowly, just making sentences, is extremely difficult sometimes. Appetite and or weight changes. They can go from gaining weight to losing weight. Irritability, if you're feeling like you're in constant pain, you're not going to be the, super happy and sunshine and wonderfulness. That's, why would you expect that? Feeling restless or having trouble sitting still. Sometimes your muscles are just aching and you can't stay in one spot, or maybe you're feeling a bit panicky. Now this is a big one. Thoughts of death or suicide attempts. Then we have the aches or pains, headaches, cramps, digestive problems, so your whole body can hurt. You have a hard time concentrating or remembering, making decisions. Here's where we were talking about that psychosis. Now, if you have a psychosis where you're having delusions and hallucinations associated with guilt and helplessness and worthlessness, maybe you have a demon that shows up and tells you how horrible you are and you should die, that coupled with depression, that's pretty awful. So that's the psychosis depression, the psychotic depression. Loss of interest or pleasure in hobbies and activities, and then you have a hard time sleeping. You wake up too early, or you wake up throughout the night, or you oversleep. Now it's important to note that anybody who suffers depression may not necessarily have these particular symptoms, or they might have one, they might have all of them. So it's important to note that people are different. People are absolutely different. And so they may or may not have certain symptoms, or they may have all of them. So the point is there's lots and lots of crippling symptoms. People are different, and symptoms are going to vary in degrees. Not everyone will experience every symptom at once or at all. They can have moments where maybe today is a hard day to make sentences. Maybe today is a hard day to walk because everything hurts. Maybe today is the day that that you're completely and utterly irritable. Everybody is on your nerves, and it's not their fault. And so you have this internal struggle of trying to deal with your own stuff that you're going through without making everybody else angry. So there's also anxiety associated with depression. Now, it is important to take note of symptoms over time to help you understand if there's a problem you need to address. Now notice, some of these particular diagnoses expect you to have symptoms that last longer than a certain period of time. So it kind of helps to sit down and write out, I thought this day, especially if you're trying to track whether or not you're suffering depression. Write down your insomnia, write down if you have unexplained pain. If you have like a stomach virus, that's not the same as having chronic pain associated with depression. If you keep track of your symptoms and you kind of see where they are over time, that can give you a lot of information. And not only that, if you feel like you have to go to the doctor and you have this information over the course of a few weeks, even if it's just a few weeks, that's still going to be valuable information that you can give to your doctor to have them determine whether or not a diagnosis of depression is possible. Now, if you are uncertain, guess what? You can still talk to your doctor and say, doctor, I've had this, and this, and this. And your doctor can go, okay, let's have a look. All right, I don't think this is depression. This might be this here. And they will have fact-finding questions to ask you in coordination with what it is that you've been tracking. So that's exceedingly important and can help you. I'm glad you think this is good advice, Mrs. Snarky. Yay! So, I kind of want to talk about, that's what my doctor has me doing for the last couple of months. That's a good idea, Atheist Bob. And doctors are scientists, and they need evidence, and they need data, and the more data you give them, the more confident they can be in making a diagnosis. Now, when they do go through and diagnose you, they are able to do brain scans. So they can do brain scans now and kind of see if there's a link there as well. Because people who suffer depression have different brain scans than others. And so if you feel like you're struggling and you might have depression, the first thing you need to do is, especially if you're having thoughts of suicide or self-harm or anything like that, go to the doctor first. Talk to the doctor. And even if you haven't kept a log, go seek help as soon as you can. Talk to a loved one, talk to a family member. Ask them, have you noticed any changes in my behavior? Sometimes it helps to get an outside perspective. Now, if there's somebody that you can trust, that'll be like, yeah, I've noticed you've been a bit more irritable lately over the past few weeks. Are you okay? Asking them, or people who are around you often, can notice and say, yeah, I have noticed this particular aspect. And so that's good to kind of get that perspective as well, especially if you haven't been keeping track and you're worried that maybe you might have something that you need addressed. Asking people who know you really well and who can see the change in your personality is also helpful in giving that information to your doctor. Don't ask somebody who's a jerk. Don't ask somebody who's mean or awful to you. That's a terrible idea. Ask a person that you trust, that knows you well, and has been a support and a kind person to you in the past. That's important. We need to listen to those people. So, one thing I want to do is talk a little bit about the risk factors. There are some risk factors, but there's still a lot of information about depression that we don't have just yet. If there is a personal or family history of depression, major life changes, trauma or distress, physical illnesses, and certain medications can cause you to fall into depression. Also, LGBT children and transgender youths are at a higher risk. Yeah, don't hide how you feel. Just let loose and tell them how you feel. That's exactly correct. We can't help the people we care about if we don't know that there's a problem. And my picture has covered risk factors. That should say risk factors. Risk factors. See, your brains are amazing. You probably filled in the rest of that without me having to tell you. That's how awesome our brains are. So your family history is going to play a role in that. Medications. I cannot take any kind of hormonal type of anything. I can't do it because for me, now I wasn't technically diagnosed with medication-induced depression, but for me, I cannot take any kind of hormones because it makes me completely non-functional. I cry, I lose my, even on the lowest dose of hormones. I am so susceptible to hormones that altering my body chemistry in that way causes me to completely be non-functional as a human trying to do a job and crying and stuff. So yes, medications can actually induce depression. So if you are on any kind of oral contraception, there's a lot of studies related to this. If you're on any kind of oral contraception and you've noticed like in the past few months that all of a sudden you just feel horrible, just awful, and you're having suicidal thoughts. Hormones can mess you up really badly if you're not closely watched by your doctor. So report any and all symptoms, especially with medications, if you notice your mood changes. That's very, very important. Having a good support system can make a huge difference. I agree, Mrs. Snarky. That's absolutely right. You have to have people there to kind of hold your hand and help you ride the storm. Because sometimes, you know, you can't, and when your mind is telling you this is never going to end, you know, you have to have another. See, sometimes I get anxiety and I have to have somebody repeat something to me like 4 or 5 times saying, you're doing a good job. I'm like, oh, am I though? Because I'm an overachiever. And so if I do something that's not perfect, you know, I'm like, oh, I didn't do this. That's perfect. They're going to think I'm stupid. And then my friends are like, you know, you're not stupid. You know you're not stupid. Quit saying that stupid stuff. And that's mild, okay? So for me, sometimes I have to have my friends remind me, you're doing just fine. You're okay. Take a breath. Now, that's mild. That's nothing like what people in depression go through. But I can see that it's pretty freaking valuable to have a person there that says, hey, this is temporary. I know this might be 2 days, it might be a day, it might be a week, but you know this is temporary and it's horrible right now, but we're here for you. Well, we can just sit and not talk and watch Netflix all day. What do you want to watch? I just don't want you to be by yourself. I'm going to be right here. Let's have jammy day all day and watch cartoons if you want. You know, sometimes you just need that, you know, and that's coming from people that I've talked to who suffer depression. So sometimes that's helpful. So hopefully that helps a bit here. There we go. I had to move the chat up a bit on there. So what are we talking about in regard to risk factors? All right. So the thing is this. Depression can hit anyone at any age. It knows nothing about success, gender, privilege, money, friends, sunshine, hobbies, or life's demands. It knows nothing about this. It is a selfish monster that cripples a person to the point they can barely form words or get out of the bed without excruciating pain. Depression is a liar, a thief of happiness, and an expert manipulator to force you into a constant state of pain where all you can think of is ending the torment. So, I'm so sorry you feel depressed. Knowing that you are able to have the weight not matter helps a lot. Life and its problems do not have to matter. It is about how much weight you put into the problem. Now nothing bothers me. Well, that's good, Gary. I'm glad. I'm so sorry you're feeling depressed. So it's important to note, depression is a liar. It's a liar. It lies to us. You know, it lies, to people who have it, and it convinces them that, and it puts them in a constant state of pain. So this is something you have to keep in mind if you don't suffer depression. Just because you don't see it going on, it's not like leprosy where we see sores. It's not like cancer where you can see somebody's lost their hair from chemotherapy. It's something that can hit any particular day. One day a person will be completely fine, happy, and smiling, and the next day they are being tormented by their mind. That's what depression is. So it's important we have this understanding. It's not something that you can just get over when your very mind, the thing that controls the rest of you, is not functioning to full capacity. That has an effect. And so people who don't suffer depression, you have to understand when your control center is short-circuited, other things are not going to function so well. So let's talk a bit about treatments. There are treatments, medication, and therapy, and activities. So we have all kinds of different treatments available, and it depends largely on the type. Here I am again, covering up treatments. There we go. And I think it looks like I need to fit this to the screen. Maybe that's been part of the reason. There, better. See, formatting issues, my fault entirely, guys. Thank you for your patience. Okay, so medication, therapy, and various activities. Now, you may have maybe a type of medication. Maybe there's a type of therapy that goes along with your medication, and maybe your doctor has had you do specific activities like getting sunshine or getting a little bit more exercise. Now, exercise and jogging by itself is not going to alleviate depression unless your doctor says this seems to be the thing that works for you. After they've tested everything else, work out until you go to sleep at night. Aw, sending hugs to you too, creator of dreams. I'm so sorry. Well, see, that's why this is my hug to you guys. I'm giving you these hugs now. It's like quantum hugs, like Doc Hack and Slash. They're here. I'm sending those hug electrons. Just, you know, I'm blasting them at you, man. Just feel the tingles. I'm trying to get you to feel those tingles because I'm getting tingles right now, sending them out to you. This is how we do, this is how I do evangelism, right? Oh, goodness. So, didn't know you could watch this on Twitter. You can watch this on Periscope. Oh, goodness. Explain how you would treat somebody who just 10.5 years in prison and is depressed. Now, I imagine there's a lot here. I'll switch over to this so we can have a good solid chat before I get into the medications and stuff. So I imagine, from what I've read on prison, I've not been in prison. I haven't done a lot of stuff in regards to prison. You're welcome, Mrs. Snarky. Have a fantastic Saturday. So, I haven't been involved in prison, but I understand that there's a lot of issues associated with that. I've looked at things such as the Stanford Prison Experiment, and there's a lot of different mental and emotional anguish that can happen in regard to prison life, and the thing that can be involved with being institutionalized and conditioned. In regard to trying to rehabilitate when you have depression like that, is exceedingly important to find somebody who's associated with the trauma that you may, somebody who understands the trauma you may have experienced in prison. I know prison rape is a big problem. So you would probably look for a doctor or a therapist that could help you work through any trauma you've experienced in prison, along with a psychiatrist to help address any kind of chemical imbalances you have in regard to the depression, to see if they can get you on medication. Because a psychiatrist is going to be the person that can prescribe medication to you. Your therapist is going to be the person to help you work through your trauma. So you really need multiple doctors to kind of help you get through that. So an occupational therapist as well might be a good idea as an aside, but you want somebody involved in therapy to deal with any trauma you experienced, in addition to a psychiatrist that is whose field is depression. So a therapist whose field is associated with any kind of trauma, and then a psychiatrist whose main focus is depression. That's going to be the best way to do it. Oh, yes, Ed Trumpy Cat, if you're familiar, I actually did a talk on my show, and you can scroll through Periscope on a show called Influence, where I talk about the Stanford Prison Experiment. So, Charles, I hope that thoroughly answered your question. Look for 2 doctors if you can. Look to see if you can find somebody to deal with any trauma you experienced while in prison, and then talk to a psychiatrist for the medication. All right. So let's get back. I'm sending all kinds of hugs to you guys today. Today's a huggy Saturday because we're talking about sad things, but we're also talking about treatments and hope. So that's good. So that's okay, Charles. All right. So the thing that I want to talk about are the different treatments. So hugs to everybody there. Let's hop over and I'm going to kind of go through this. All right, as soon as my slide pulls up. All right, medications. So one thing that you can do is medications, and certain types of medications that are primarily prescribed are antidepressants. Those take time to kind of activate. So about 2 to 4 weeks before you can even start to feel the effects of antidepressants. Now, often these symptoms such as sleep and appetite and concentration problems kind of improve before the mood lifts. So if you're on antidepressants, don't say, oh, I don't feel it after a few days. You might go, okay, you need to kind of give it a couple weeks, even as long as a month, before you'll start to feel your mood lift. However, you'll start sleeping better, your appetite will be better, and usually you'll be able to concentrate a bit better well before your mood changes. Now, there are different types of antidepressants, and sometimes certain ones are going to not be as effective as others. So it can take 6 months, it can take a year, it can even take 2 years sometimes before you can find the correct medication cocktail. Sometimes it's more than one medication to become effective because people are different. Now, some cases, especially in children and teenagers and young adults under 25, certain antidepressants can actually cause suicidal thoughts and behaviors to become worse. So in that particular age group, and this is a warning that's come from the FDA, it's important to monitor the dosage, especially with those individuals, to make certain that suicidal thoughts and behaviors are not enhanced in that regard. Now, you can go and learn more about antidepressants on the FDA website, fda.gov, and you can also just talk to your doctor about any type of new medications that are coming out. And if you're pregnant, antidepressants will actually can actually cause problems for breastfeeding and that sort of thing. So if there's any increased health risk associated with pregnancy or breastfeeding, you need to talk to your doctor about that. Have you touched on, or will you touch on magnetic brain therapy? Not sure the clinical name is supposed to be very effective. I'm about to talk about that here in just a minute. We're on treatments. We're on the treatment portion. Now, psychotherapies, okay? Psychotherapies. There are several types. We've got the talk therapy type, or what we call counseling, and that can help people deal with depression. And cognitive behavioral therapy is another one, and that's more of an evidence-based approach specific to the treatment of depression. So it's called CBT, cognitive behavioral therapy. There's interpersonal therapy and problem-solving therapy. You can go to the NIMH website, and that's where I've gotten a lot of my information. And if you want access to my sources, I do have a list at the end of this talk. It's okay if you're late. Don't worry about it. It's okay if you're late. I will post all of my slides on ScientistMel.com. You can go there, download my slides. I think I have like 15 links for this particular talk. NIMH, that's the National Institute of Mental Health. It's a division of NIH. You can go to that website, and they have something called Depression, What You Need to Know. Okay, so brain stimulation therapies. Woohoo! Sometimes medications don't work, and if that's the case, you can do something called brain stimulation therapy or electroconvulsive therapy. That might be an option for you. Now, this can provide relief for people who have very, very severe depression, and they have not been able to feel better with medications or psychotherapies, any of that sort of thing. Now, it can be an effective treatment. In some severe cases, there is a where a rapid response is necessary. Medications cannot be used safely. ECT can be a first-line treatment. So what if you have an allergy to a particular medication? What if you don't have access to a therapist, but you have access to this type of therapy? That might be the best option for you. There are some side effects, but for the most part, it was once a strictly inpatient procedure, so you had to be committed in order to get it, but now it's offered on an outpatient basis. Now, the treatment consists of several different sessions, and typically 3 times a week, from anywhere to 2 to 4 weeks, so it could take about a month, but you would go a couple of times a week to do this. Now, the side effects can be confusion, disorientation, some memory loss. Sorry, I'm stumbling over my words, but these tend to be short term. Sometimes memory problems do linger a bit, especially for the months around the time of the treatment. But there are advances that are coming along in ECT. Something to listen to at lunch. Yay! And the good news is it's not painful. But you do need to understand what the risk factors are so that you can decide whether or not this particular treatment could meet your needs. You cannot feel the electrical impulses. Now, before this particular treatment begins, the patient is put under brief anesthesia. So you're kind of put to sleep, you're given a muscle relaxant, and then within an hour after the treatment, it only takes a few minutes and the patient is awake, alert, getting ready to do whatever they're going to do. So it's an outpatient procedure. You can go onto, again, the NIMH website and look at these brain stimulation therapies. That's what it's called. Now, if you think you might have depression, it's a good idea, as I mentioned before, to write down what your symptoms are, get some input from family members, and immediately go to the doctor and talk to a doctor about it to see if this is something that you might have in regard to, how you're feeling. Now, I mentioned activities. Let me say right now, exercise and getting some fresh air is not going to get rid of your depression. Unless it's exceedingly mild and your doctor says, hey, this seems to work for you. Then that might be the case. But that is not what the standard is or what most people experience who have depression. Now, there are things that you can do along with your other treatments, or you can watch Mel to stimulate your brain. Buzz, buzz. So there are things that you can do to help lower your episodes, your depressive episodes. You can try to be active and exercise, but if your body is in a lot of pain, that's really, really not feasible, especially if you're exhausted. You could set realistic goals for yourself. Maybe if you're in an extreme depressive state, you might say, okay, today I'm going to get out of the bed. When I'm normally like this, I stay in bed all day and I don't even eat. Today I'm going to get out of the bed, I'm going to take a shower, I'm going to eat something, and then I'm going to go back to bed. Set realistic goals. And it's important that you spend time with other people and confide in people, in those that you trust. It could be a friend, it could be a relative, somebody that you feel comfortable talking to. Try not to isolate yourself. And don't be ashamed to let others help you. It's important that you do allow the people who love you and care about you to be involved in your life and be there for you. Expect your mood to improve gradually. It's not going to happen overnight. So if you're feeling horrible, you're going to feel horrible for a little bit, and it's going to take some time. Also, postpone important decisions. Don't get married on a whim or divorced on a whim or change your jobs until you're clear-headed and feeling better. Discuss these decisions with people who care about you and know you, and listen to them so you can get an objective view. I've got your phone number, the phone number for somebody. Gary put up 1-800-273-8255. Sometimes my software is a bit buggy, and I see you, creator of dreams. It's all right. And you also need to continue to educate yourself about depression. Here's the thing. Science changes and grows, and there's new information coming out all the time. So it's important to kind of stay abreast with the newest information in regard to depression. One particular group that I want to focus on, and this is pretty important. I'm going to shrink myself a bit so you guys can see this a bit better. All right. We're going to talk about LGBT youth, because that particular group is a very, very high risk group for not only depression, but suicide, and particularly transgender youth. They are at a higher risk for suicide, to where 32 to 50% of transgender youth worldwide attempt or complete suicide. There's an organization called the Trevor Project, which focuses on raising awareness as well as information and making resources available to LGBT individuals who are subjected to various types of bullying and that sort of thing, to try to let people know that this particular group of individuals are highly subjected or at high risk for depression and suicide. Family acceptance is extremely important, especially for LGBT youth. Now, one particular study that's just come out has shown that using chosen names for transgender youth helps lower depression and suicide risk. So if you have a transgender boy who used to be, who's genetically female, but identifies as male for gender, using that boy's new name that he has chosen for himself lowers depression and suicide risk. In a study from 2016 regarding suicide in transgender persons, and I quote this study, gender-based victimization, discrimination, bullying, violence, being rejected by the family, friends, and community, harassment by intimate partners, family members, police, and public discrimination, and ill treatment at health care systems. So when they're treated poorly at health care systems, are the major risk and factors that influence suicidal behavior among transgender persons. This is worldwide. So 32 to 50% of transgender individuals are subjected to attempted or completed suicide. So the thing that I found shocking about this study is that ill treatment at health care systems. So when they're going to their doctor, first, what the Hippocratic Oath, do no harm. They're causing harm, and they're pushing these young people into depression, into suicide. So it's just, it's horrible that they're bullied. Yeah, they're people at the end of the day. They are. So it's upsetting to me because, people are people, and we're hurting our own. And doctors, and family members, the very support network that people who suffer depression need in order to weather that storm. That's a contributing factor, and that's why those rates are so high, 32 to 50% worldwide, 32 to 50%. So if you go to a bar and there's transgender people there, half of those people are at risk for attempted or for suicide. Half of those people, just about half. So that's a real number. That's kind of worse than cancer. That's worse than smoking. That's worse than homicide. That's worse than unintentional injuries. Tripping and falling. They have a greater risk of killing themselves through suicide, death by suicide, than anything else. And it's horrible, and it's all likely preventable because of those other factors that we can remove. So it's not so cut and dry, and it's a difficult topic, but we also need to understand every aspect as much as we can in order to kind of combat this. So now I'm going to give you some information from the Trevor Project. And these are a bunch of facts and statistics that they've compiled together. And you can go to their website and kind of dig a bit further into where they get their information. They're pretty solid sources. So, it is pretty bad. I have an episode of Hey ScientistMel, my podcast, where Memphis Scipion, she, if you don't follow her on Twitter, she works out of DC, and her work primarily focuses on racism trauma and trauma associated for individuals in the LGBT community. And so we have a really good talk about the mental health issues that are for those individuals, and it's largely due to societal constraints and society abuses towards them. So it's pretty horrible for transgender people, especially with depression and suicide. So among the LGBT community overall, Suicide is the second leading cause of death among people ages 10 to 24. Now, in 2016, I will tell you, it's the second leading cause of death for young people ages 10 to 34. LGBT youth seriously contemplate suicide at almost 3 times the rate of heterosexual youth. These youth are also almost 5 times as likely to have attempted suicide to heterosexual youth. And of all the suicide attempts made by youth, LGBT youth suicide attempts were almost 5 times as likely to require medical treatment. So the suicide attempts are far more severe with these individuals. Suicide attempts by LGBT youth and questioning youth are 4 to 6 times more likely to result in injury, poisoning, or overdose that requires treatment from a doctor or nurse compared to their straight peers. There was a national study where they showed that 40% of transgender adults reported having made a suicide attempt. That's at least one. And 92% of these individuals reported having attempted suicide before the age of 25. So 92% of these individuals reported having attempted suicide. So, let's just take a moment to kind of pause. So 90% of those individuals that had made at least one suicide attempt, they all did it before they were 25 years old. So it's just really upsetting. Now, the LGBT individuals who come from highly rejecting families are 8.4 times as likely to have attempted suicide as the peers, LGBT peers who reported no or low levels of family rejection. So family acceptance is so important in preventing or at least lowering the risk of depression and suicide. 1 out of 6 students nationwide in the grades 9 to 12, so these are teenagers, seriously considered suicide within the past year. And each episode of LGBT victimization, such as physical or verbal harassment or abuse, increases the likelihood of self-harming by 2.5 times on average. Now, all of these stats are available to you on the Trevor Project. This is actually pretty freaking frightening, just how rampant and scary this is, and how upsetting it is. And we can remove a lot of these factors, but people, our current society isn't doing much in regards to awareness. So that's why Pride Month is kind of important, to kind of boost awareness on that. You know, these are human beings. We're all human. We're people. Love is love. You know what I mean? So love is love. Let's focus on this. Okay, so here are some statistics on suicide from 2016. This is from the NIH. As I mentioned, second leading cause of death in ages 10 to 34. And here's just something that's pretty important. Some people, they think suicide is popping, poison, taking some pills. That's one of the, I think that's the overdose is considered one of the lowest instruments. It's not anywhere near the most used. There would be guns. Firearms are the main instrument in 2016 for suicide. Some people still think that sadness is caused by demon possession. Boy, that's pretty awful. The rate for suicide has increased and has continued to increase every year since 1999. Males are at a higher risk than females for suicide. That's why we have an International Men's Day that focuses on mental health. That's the main focus of that particular day. We do have an International Women's Day, but we also have an International Men's Day. But the focus of that day is mental health, because men are at a higher risk for suicide than women. In 2016, there was an increase in American Indian and Alaskan Native suicides. And overall, the highest amount of suicidal thoughts tend to show up in people ages 18 to 25. So these are the stats in the U.S. What are we dealing with? I want to kind of show you a bit more of U.S. stats here. All right, so in the past year, this is from 2016, suicidal thoughts and behaviors among U.S. adults in around 20, and this comes from SAMHSA. So 9.8 million adults in 2016 had serious thoughts of committing suicide. Now within that 9.8 million, 2.8 million adults actually made suicide plans, and 1.3 million adults attempted suicide. And of those, 0.3 million adults made no plans but attempted suicide. And of that, again, 1 million had made plans and attempted it. So the 0.3 million, that's still a large amount. They just committed suicide, no particular plans. So it's kind of striking. It's kind of striking in my opinion. And I haven't really thought about this so much, but as I was compiling this together to try to get all of my information, checking my sources and that sort of thing, it struck me just how upsetting this is. And for me, I'm sitting here, I'm like, suicide kills more people than cancer. Suicide, let me just say that again. I'm just going to hear. Suicide kills more people than cancer in ages 10 to 34. It kills more people than homicide. It kills more people than diabetes. It kills more people than heart attacks, blood pressure. Suicide. It's the number 2 leading cause of death among individuals from 10 to 34, ages 10 to 34. So it's pretty frightening and upsetting, but it's something that we kind of need to address and talk about. People are like, well, suicide, why is everybody killing themselves, blah, blah, blah. Well, they've been doing it for a long time. This isn't new. Depression isn't new. It's not some profound random thing that's just started happening. And the thing is we're seeing more and more diagnoses for depression, which isn't necessarily a bad thing. That means more people are being diagnosed and more people are getting the help they need. That's a good thing. All right. According to the World Health Order, global stats for suicide, 800,000 people annually die from suicide. In 2015, 78% of suicides occurred in low to middle income homes. It's the second leading cause of death from ages 15 to 29 in 2015. In 2016, it went from 10 to 34. So we've got a broader range now. Now, there are some indicators, according to the World Health Organization, that for every completed adult suicide, there are at least 20 attempts. So we have, for every one, there's 20 other people that have already tried. This is a very real number. So this isn't like, the happiest thing to talk about, but it's important that we kind of understand what's going on here and what the factors are and the triggers and that sort of thing. Because it's killing more people than cancer. So what can we do? So those of us who don't suffer depression or have suicidal thoughts or anything like that, what can we do to help? It's a disease we can't see. It's not like depressed people randomly start sneezing and they cough and then you know that they're depressed right now. It's something that's much more insidious in that their minds are actively trying to kill them in a way. So, but it's something that we as non-sufferers need to have kind of a way to respond. So what can we do? Well, I took some time and I wrote an article on ScientistMel.com, Depression, How to Respond as Non-Sufferers. And I spent a lot of time talking to people who suffer depression and the different things that they go through. And I asked them, what is it like? And they would explain to me different things. So I got feedback from a lot of different people, coupled that with my own research on what I could find on depression. And then I asked different people what works for you. What do you need when you suffer? I know I have friends who suffer depression, and I know them well enough when I know they're down. It's not just reaching out, you know, and it's not just telling your friends reach out when you're low, because sometimes they can't. Sometimes they're incapable, or it's impossible for them to reach out to you. They need to be checked on. They need a solid support network. They need a community that welcomes them and gives them a space to feel awful without guilt. Don't make a person feel bad for feeling awful. It's not their fault, and they need to know that they're not a burden. And so this comes from my article that I wrote on this particular thing, as I had a very positive response from it, from those who suffer from depression, and they're like, yes, this is what I need. So if there's anything anybody ever wants me to add to this, please let me know, and I will. It's as simple as that, because this was an article that I spent a lot of time on to try to get perspective so I could relay that to people who don't suffer. So for those who do not suffer, it's important we understand what is and is not helpful when we interact with those in our lives who struggle with the black dog. That's another way of calling it depression. Sometimes that black dog is awful and it's barking at you all day, and sometimes it's just quiet and in the corner, but it's always there and waiting. Things to note: there is no getting over it quickly. There's no snapping out of it. There's no focusing on the positive with depression. It isn't something that can be turned off or on at will. It is a full body experience. It is exhausting and hard to cope with for many people. Communication is exceedingly difficult for someone when they are low. Blame is very harmful at this stage. People who suffer cannot control what's happening to them. They wish they could. Blaming them will hurt your relationship and cause further damage. So how we respond to our loved ones and friends who suffer depression can make an impact on them, positive or negative. We see that in studies with LGBT youth. They have to have that support network, especially when their depression tends to stem from society that's trying to harm them. So they need that support network. So what do? Here are some beneficial ways to respond when a loved one or friend is suffering and or having a low day, as well as what to look for. So it's a long list, so I'm going to try my best to get through this, okay? So what do? First thing you want to do is offer an ear. They don't need platitudes. They don't need words of insincere encouragement. Sometimes they just need someone to listen without saying anything. Just listen. Just listen and sit there. Give them time. Tell them they matter to you with honesty. Don't try to fake it. Do it with honesty. Give them examples of what they do to make your life better. They need to hear that. Visit them often, assuring them that you want to be in their company, even if that means sitting on the couch, not speaking, and watching television. Netflix, Amazon, whatever. If that means binge watching Netflix on TV, can visit them often and assure them that you're fine with that. They may push you away as a means to cope or be less of a burden. Remind them how important they are to you and that you are there and they matter to you. It's important they know that they are not a burden, because people with depression often feel very, very guilty for not being in a good mood around other people. So do not be insincere. Be patient. Be patient and say that you are their friend. You are here. Supporting each other is what friends do. This is not a burden. And remind them you would do the same for me. Would you not? If I'm sad, aren't you always on the phone calling me, making sure I'm happy? Why wouldn't I do that for you? Watch for changes in their behavior, and this is very, very important. Watch for sudden changes. If a sudden shift to happy happens, stay close to your loved one. They might be, oh, I'm really happy today. That might be a mask, and they might be really struggling. spending time and understanding how to interact with your loved one can give insight to what helps them when they are low. If they know on a regular basis that you are here for them, they will reach out and talk when they need. They're not always going to reach out. But if you're always there and you're trying to reach out, what if you're an isolator? Well, that's the thing that's kind of important. If you're a person that tends to be isolated, if you have somebody that you know understands that about you, that's somebody that's known you long enough that understands that about you. And if you communicate that when you're not low, you have to be honest when you're not low and let them know that sometimes you need to be by yourself, but let them know what your triggers are, or let them know what your indicators are when you're actually struggling. Finding a support group is a good idea for that. Now, another thing, as a non-sufferer, understand that people who suffer depression may have angry words to push you away as they may be low. This doesn't mean they don't care. Sometimes there is a comfort in quiet, like you're an isolator, and not being around others. Sometimes this is a sign they need care. Communicating when they are not low helps understand what your loved one needs when they do this. And so that's why communication when you're not low is important in letting people know what's going on, like what you need when you are low. Because when you're low, you're not 100%, so it's hard to do that. But see, if you push your family away, your family should know you well enough to go, okay, they're low right now, and I know this, and sometimes that can weigh on your family sometimes, I'm not going to lie, but your family who support you are going to understand it. So, being a friend or a loved one to someone who suffers depression can be challenging and frustrating at times. Yeah, this is okay. It's okay. Be certain as a non-sufferer to institute your own self-care to ensure you have a healthy outlook in order to respond helpfully. So, when I'm dealing with somebody, and it can be exhausting. It can be exhausting to try to be a constant rock weathering the storm for somebody who suffers. So it's important that we as non-sufferers also take time to step away for a minute and institute a bit of self-care to kind of get grounded again and, kind of keep ourselves in check and make sure we're taking care of ourselves so we don't respond in an unhelpful manner. People who suffer depression may have the mindset that no one cares about them. It is important to reinforce how very wrong this is. However, it is also important to understand that compassion must couple with any statements you make in regards to stating their argument is incorrect. You do care about them and love them, and you need to give them examples. You need to remind them, you remember this time here, because they're not going to remember. They're not always going to remember. Now, as a non-sufferer, do not be afraid to ask if they are having thoughts of suicide or self-harm. Giving your friend a free space to just talk without fear or judgment can be all a person needs to get through that storm. Oftentimes, they do not want to hurt themselves. They just need to get the words and the feelings out safely. If you think the threat is serious, call a professional to help and give you advice at that point. And lastly, listen. Ask them when they are low and what you can do to help them wade through the storm at the varying levels of depression, because it is a spectrum and the symptoms are going to vary. Asking what their level is that day can help you understand how to respond. So my idea was to make my family hate me so I could not hurt them when I was planning on the whole make myself have a permanent sleep. Yeah, but your family does care, and they're going to stick it out, and they're going to understand that you're not fully 100% when you're low like that. And it's temporary. And people who know you know that. And the people in your life who understand that you suffer depression will say, okay, they're low right now. I need to do these things here to help them get through it. And that's what we can do as non-sufferers for those who suffer. And that's the end of the talk. Whoops, I hopped a bit too far. Let me go back a bit to the previous slide and kind of sum up what it is we've talked about. We've talked a lot about depression. We've covered a whole lot of stuff. We've talked about what it is, all of the types, the symptoms, risk factors, who has it, the treatments. We've talked about suicide. We've talked about how to respond as people who don't suffer depression. Education is important. And it's important that we focus on learning more about depression. Not just so we can try to fight it, but also so we can understand what we can do as people who don't suffer depression. And also there are people who suffer depression and don't realize they have it. And that's one reason why we're seeing an increase in diagnoses. People are understanding or are becoming more aware about depression. Like, okay, maybe I do have this, and maybe I can get help and not feel this way. That's a good thing, you know? I found the solution is to quit caring about all the things that made it bad and to just focus on the small things and not care. Now I feel great. Well, I'm glad that works for you. That's awesome. I think, I kind of think about Doctor Who a little bit, and I'll end on that here in just a second. But here is like all the 9 billion links. Yeah, I think it's like 15 different links. And so I'm updating my website today. I'm going to include this entire slideshow to where you too can download all of this information. You can share it with other people. If you're an educator, feel free to add this to a list. Use it for your own personal use. Just give me a nod, like ScientistMel, thanks. That's fine. But it's here for you to help educate yourself and others. You can dive down a bit further, check into all of the different stuff that I looked at, and kind of educate yourself. So I'm glad I could be here with you guys and doing this. I'm going to take a moment to thank my patrons. They help me do what I do. And if you like what I do, my pledges start at just $1 a month. And now they have special roles on Discord. Woohoo! And they get their own show every Sunday morning. It's called Sunday School. Science Sunday School, where I go over the latest and greatest stuff associated with all of the new things on science. So they get like their own little show, and they get access to that stuff, live stream, Sunday Science School, or Science Sunday School, just for them. So Tony, James, Lauren, Jen, Carl, Melanie, Patrick, Daniel, Stephen, Paula, Tim, Carrie, Cersei, Keith, Zachary, Tony, Bo, Stephen, Sarah, Graham, Dragnot, Godless Iowan, Jennifer, Corey, and Heavy. Thank you so much for helping me do what I do. Because of your contributions, I have a better camera. I have a website. I have a charging pack that I could take to NASA. I have a dedicated server now, not a server, but a dedicated desktop just for ScientistMel 24. Hey, ScientistMel 24/7. Live streaming shows all the time, 24 hours a day, 7 days a week, except when I'm actually live. That's when I'm here, and that goes on pause. Because of those contributions, I have new lights and all kinds of stuff, and I have a green screen I'm going to start playing with soon. So we'll see how that's going to go. And also, this Thursday, I'm going to have the next Spirited Science episode where we talk about Alan Turing for Pride Month. So, last little bit here, and then I'll kind of end. You can find me everywhere on the internet, ScientistMel. I can send you an invite for my Discord, patreon.com, Periscope, YouTube, Facebook, and I am now on Twitch. If you're watching me on Twitch, yay! Thank you for being here. So I will end on thinking of Doctor Who in the Van Gogh episode. Gosh, you know, you got the good pile and you got the bad pile of life. Are you adding to the good pile? You know? So a person who suffers from depression, they're going to have things in their bad pile. Add to the good pile, guys. Oh, I'm going to cry. I'm thinking about that episode. I got my TARDIS right here. That episode gets me every single freaking time, man. I was like, oh, God, freaking Van Gogh. I saw his work in Chicago. All of the bedrooms side by side. And you could see the progression of his work. And I was just wept. It just wept knowing the mental torment that he went through. And the genius in the paintings. To me, it was just, and I'm a scientist, you know, I shouldn't be all into the art, but I totally am. And it's just like amazing knowing what was going on in his mind while he made this. It was just fantastic. So, guys, continuing on, I wanted to cover a lot of this. So I'm so glad I got to do this with you. This was absolutely wonderful. And I was afraid I was going to get all choked up during it. I almost did. I almost did, because I know people who suffer, and this bit's a lot to me to do, so yay! Doctor Who, add to the good pile. Check us out Thursday night, 8 Central Standard Time. We will be doing a Spirited Science episode on Alan Turing, and quite apt for Pride Month, especially with the talk that we just gave now, and his wonderful contributions to computer science. I will be making that cocktail soon. I'm getting together with my friend Alexander, who's a bartender, who's helped me make all of my drinks. So thank you, Alexander. Your help is wonderful. Thank you, Gary, for helping me out on things. And thank you guys for being here. It was wonderful to share this Saturday science with you. And I will see you guys everywhere on the internet. Sending squishy science hugs. Can you feel them? Can you feel them? Also, Doc Hackenslash, I'm going to give a little shout out to him. He wrote a thing about it, and he's an advocate for those who suffer depression, and he reaches out a lot to people. So if you ever need to talk, you can always talk to him on Twitter. Yes, and Alan Turing, gosh, my heart breaks for him. He's freaking amazing. Can you imagine how further we'd be if we as a society didn't treat him so poorly? You know. So, sending squishy science hugs, and I will see you guys Thursday night, 8 Central Standard Time. And if you're a patron, I will see you on Sunday tomorrow with my Science Sunday School.